Welcome to Module 2 of the Childhood Feeding Collaborative online training, Helping Parents to Feed Well so Children Can Eat Well. This training is for community health workers, promotores, parent educators, or other staff who work directly with parents of young children. This training is created through the generosity of the Health Trust and supported by the Santa Clara County Public Health Department, Helping Parents to Feed Well so Children Can Eat Well, and its parent education handouts and resources are part of the Public Health Department's commitment to prevent chronic disease in early childhood. This is the second of 4 30-minute long modules. In Module 2, you will learn how the division of responsibility supports children in learning how to eat with a focus on the infant and transitional child. Here are your Module 2 learning tasks. Notice that this is a continuation of task numbering from Module 1. First, you will learn about and understand the division of responsibility and how it applies to feeding and food selection for the infant and transitional child. We will begin our discussion of including children in family meals. At the end of the module, you will be asked to reflect on how your learning from both Module 1 and 2 will change how you educate parents of infants and the transitional child. These 5 handouts are an important part of your learning and well worth the effort it takes to use them in the suggested manner. The worksheet, Reflect on Your Learning, requires your written input. You can type directly onto the PDF. Before starting this training, you should have downloaded this module's handouts and printed them out or saved them onto your desktop. If you have not done that, you need to pause this training, go back to the Module 2 webpage, and open the handouts. Let's continue the training with Learning Task 4. The division of responsibility defines the parent and child feeding relationship. The focus from the start is on relationship and on building competence. The division of responsibility helps parents to feed well so children can eat well, rather than on fixing the child. This focus has everything to do with solving child eating problems. Too often, parents and educators focus on fixing the child, on identifying what he or she is doing wrong with eating, such as not eating enough fruits and vegetables or eating too much or too little. Essentially, they are saying that the child is flawed, now fix him. Instead, the flaw lies in the feeding relationship. Parents cannot fix their child, but they can improve how they feed their child, and the child will respond. SDOR, or Satter's Division of Responsibility, was defined as a result of the pioneering work of Ellen Satter more than 25 years ago. The American Academy of Pediatrics identifies Satter's Division of Responsibility as best practice parenting for feeding children. The United States Department of Agriculture and its Food and Nutrition Service, which administers WIC and the Child and Adult Care Food Program, includes Satter's Division of Responsibility as the basis for their core nutrition messages for young children. Please access the handout, Ellen Satter's Division of Responsibility, now. In infancy, the division of responsibility is pretty simple. Parents are responsible for choosing what the infant eats, breast milk or formula. Then they follow the child's lead for everything else. They time feeding for when the baby is quiet, alert, and hungry. They help the infant be calm and organized. They pay attention to information coming from the baby about tempo, frequency, and amounts. Parent attention to these infant cues enables the parent to feed the infant according to the division of responsibility. Feeding in a developmentally appropriate way is feeding based on information coming from the child. The division of responsibility in feeding is developmentally responsive feeding. This handout from Module 1, Stage, Developmental Principles, and Key Concepts in Feeding, describes this responsive feeding style. Feed the Way Your Child Can Eat is a parent education handout that you can access later in your resource folder. It is available in English, Spanish, and Vietnamese. It provides information on what to eat based on the child's developmental readiness. In your resource folder are resources that will help you provide best practice feeding education to parents of newborns. This training is not intended to teach breastfeeding, as there are many excellent resources on that subject. However, these materials and this training are consistent with breastfeeding and positive formula feeding practices. The transitional child is the older baby transitioning to solid food to become an almost toddler who is ready to join in with family meals. The almost toddler developmentally straddles characteristics of the older baby and toddler. Feeding the transitional child is difficult for parents because, well, everything is in transition. The child is continually changing and learning, and parents have to continually tune in and respond. During this stage, the division of responsibility goes through a transition as well. The parent is still responsible for what foods are offered the child. As the child eats more regularly and at longer intervals, the parent begins to be responsible for when and where eating occurs. The child continues to be responsible for how much she eats and whether or not to eat the foods offered by the parent. Parents support the child through feeding transitions using the parent skills that we discussed in Module 1. These skills are understanding how the child learns, having developmentally appropriate tasks, giving many opportunities to learn, and trusting the child to learn. Parents must also recognize and accept normal child eating behaviors. These parenting skills will help the parent introduce solid food based on what the baby can do, not on how old she is. They will help parents respond to normal child eating behaviors. Babies vary in how they take to solid food. Some enjoy solids right away. Others take time and need lots of opportunities to learn. Other babies aren't interested in being fed from the spoon and wait to eat solids until they can finger feed themselves family foods. First, semi-solid foods can be homemade pureed food or commercial baby food. Modified family foods have the advantage of gradually introducing the flavors and textures of foods that the family eats. The WIC food package provides commercial baby food 6 through 12 months of age. However, to keep children from getting stuck on pureed foods, WIC parents need to begin offering thicker and lumpier foods and then soft and easily chewed family foods. The next slide is a video showing parents introducing solids for the first time to their twin boys. The twins are younger than the recommended age of 6 months, but are within the age range of when solids may be appropriate. To help you identify which twin is being fed, notice that first the mom feeds Micah, and then the dad feeds Sam. I like this video because it shows two identically aged children who respond very differently to the introduction of solid foods. See if you can tell the difference. For more information on how to feed your older baby solid foods, please explore the link embedded in the PDF for this module or visit the Ellen Satter Institute website. As you watch the video in the next slide, you will use the bulleted list to evaluate the feeding. Your task is to decide if Micah and Sam are each ready for solid foods and if the parents follow the division of responsibility.
What's that? Do you want to try that?
Oh.
What do you think? Oh, you like it? That's a big smile.
Oh, that's
Do you
yummy.
like it? Open your mouth again. Open up.
What do you think of that?
What do you think? Is it good? That was the best smile we've gotten so far. Okay, what do you think? Is it good?
Good
Is it
job.
good? What do you think, bud?
You're so sweet. Buddy.
Hey, Micah. Micah. Look at him
sees
opening
it.
his mouth. Good job, sweetheart. Good job. Good job.
Oh. Whoa. What do you think of that?
You open your mouth. Oh, what do you think?
How is that?
What do you think?
Oh.
What do you think? You hear mommy? Hey, do you hear mommy over here?
Hi, bud.
He's not sure.
Can you see that? What's in your mouth?
What do you think?
Hope you can kind of see. Oh.
What do you think that is? Kind of feels strange.
How is that?
Oh, is that yummy? Is that good? What?
Are you smiling?
Is he looking at you, smiling?
I thought the butt was a pan on my head. A pan on the head? Uncle Ben.
You're silly.
How did you assess the feedings on each of these points? You probably assessed each boy differently. These were challenging feedings to assess. Watching Sam, you can understand how a parent could think that he doesn't like the cereal. However, Sam is just not developmentally ready. He'll like the cereal in another month or so. Too early solids feeding won't help him get ready any faster. We'll watch this video again, this time with the voiceover explaining the feeding relationship and Micah and Sam's readiness for solids. Follow along with your handout.
Micah, 4.5 months, is getting his first introduction to solid food.
What do you think?
He likes it. He sees the spoon coming and opens his mouth when Jennifer touches his lip with it. Keeping it slow gives him time to react. Micah's not quite ready to start solids. He needs a lot of support to sit up. His head is unsteady. He may or may not be able to close his lip over the spoon and swallow, and most of the cereal comes back out on his chin. But it's okay to offer Micah solid foods. He's interested, he and his parents enjoy it, and his parents stop at his first sign of not wanting to eat. Babies develop differently, even when they're twins. Micah's brother Sam is skeptical of solid foods. Nathan is respectful and engaging with feeding, and his tempo is no more rapid than Jennifer's. Sam's sitting and mouth skills are about the same as Micah's, but Sam's attitude is entirely different. He's not interested.
What's in your mouth?
His parents wisely pay attention to his reaction and stop trying to feed him. Respecting Sam's wishes now will make him more likely to accept solid foods later on. However Micah and Sam feel about starting solid foods, being part of this cheerful family meal shows them what eating is all about. This is, of course, not recommended practice for using these seats. Ordinarily, Micah and Sam sit in the middle of the table, and their parents keep a close eye on them to be sure they can't kick or wiggle themselves around.
Skill development is especially apparent in this next video, which contains narration explaining the feeding relationship in terms of the division of responsibility. Madison and Daniel are developmentally almost toddlers. The video demonstrates how the transitional child can join in at family mealtime. For more information on how to feed the almost toddler, click on the link provided in the PDF for this module or visit the Ellen Satter Institute website. As you watch the video in the next slide, use the bulleted list to evaluate the feeding. Childhood Feeding Collaborative has other related handouts available in English, Spanish, and Vietnamese. You will find them in the Resources folder on the home page.
These year-old twins are eating most of what their parents eat and feeding themselves with their hands. Madison is hungry and ready to eat, and so is her brother Daniel. Pam and Alan have adjusted their mealtime so they can enjoy eating with their children. Alan picked up a pizza on the way home from work. Pizza is soft and easy to chew. He and Pam have cut it into small enough pieces so the children can feed themselves. Maddie gags a little. She can breathe, so she isn't choking. She accepts a little back patting from her mother, but she can work that bit of food off the back of her tongue by herself. Daniel has good hand and mouth control and so enjoys feeding himself that he eats almost anything. Even though he's chubby, Daniel must be allowed to eat as much as he is hungry for. Studies show that trying to get children to eat less makes them eat more when they get the chance. In the long run, restricting Daniel will make him fatter, not thinner. Alan ignores his telephone. Even the ringing distracts Maddie. Telephones, texting, and television take away from family meals. Children know they're being ignored, and they don't do as well. Maddie puts food in her mouth, samples it for taste and texture, then spits it back out again. This is typical eating behavior, but Maddie isn't finished with the food in her lap and goes after it. This time, she chews it up and swallows it.
Watermelon, Daniel. He's revisiting the cucumber.
In goes the strawberry. Out it comes, back in. Notice her mouth action.
Whatever you want. Don't have to eat in any order.
Do you want a knife for your pizza, or are you good?
I'm fine, thanks.
Now for some watermelon. Maddie can bite off and seems to use her whole face to eat. She uses her tongue to push the food between her jaws. Maddie is right on the verge of learning to chew. Daniel is still eating enthusiastically. He's tuning in to his hunger and fullness and eating as much as he needs. His parents maintaining a division of responsibility in feeding will let Daniel grow up to have the body that's right for him. Maddie drinks from an open cup, which lets her mouth develop. Now that the children eat and drink so much at mealtime, they won't miss their mealtime bottles and don't need them. After a while, they can still have formula in a bottle or a cup as a bedtime snack. Maddie is good at this and would dearly love to do it all by herself. She'll be able to do that surprisingly soon. For the next few weeks, her mother's wise to give her some help.
Just wants milk.
Can we wipe up real
If
quick?
Pam could stand it, it would be better to skip this wiping up. Trying to keep Maddie clean during the meal is hopeless anyway, and Maddie's impatient with it. Is that why she knocks her plate onto the floor? Daniel's lost his plate as well. At this stage, using a plate isn't necessary. Daniel cares deeply about feeding himself, even though it's a struggle for him to do it.
This approach might work better than actually cutting it up, because it'll take
Not letting him feed himself could cause feeding problems. Eventually, Daniel loses interest, stops on his own, and the meal is over.
The video of Madison and Daniel is thought-provoking because of the weight difference between the two. In spite of the fact that Daniel is large and heavy and Madison is small and slim, they are fed the same foods and both are allowed to eat the amount they want. Did that surprise you? Children are born with the ability to eat the amount that they need. Here are 3 studies that investigate this inborn capability. In the first study, by Foman and Filer, infants showed that they modified the amount of formula they ate to get the calories they needed. When formula was diluted, they ate more, and when formula was concentrated, they ate less. With such variation, parents are poor predictors of how much an infant or child will eat. Rose and Meyer reinforced the idea that infants eat the amount they need and further showed that you can't tell by looking how much babies need to eat. In their study, fat babies ate fewer calories per pound of body weight than thin babies. If you are tempted to stereotype fat babies as eating too much and thin babies as eating too little, this carefully done study shows why this thinking is incorrect. When the parent follows the division of responsibility, the baby can maintain this important capability of energy regulation. Birch and Davison show that the amount that children eat varies throughout the day. After a small meal, a child may eat a larger snack. Children compensate for these differences in amounts they eat at mealtimes and snack times. This study shows why children need to be responsible for how much they eat. A parent just can't know meal to meal what is the right amount for the child. Feed large and small children the same according to the division of responsibility. Think about this statement. How does it fit with what you previously thought about feeding large and small children? If you struggle with this concept, the next modules will address your concerns. If you are viewing this training with others, pause the training and discuss your thoughts. This 5 Keys to Raising a Healthy, Happy Eater Action Plan handout and the Spanish version are located in your resource folder. It explains the division of responsibility on the front and offers 5 selections for behavior change on the back side. Parent educators and parents like this simple handout. Let's go to Learning Task 5, including the transitional child in family meals. A family meal is when people sit down together, face each other, eat the same foods, and enjoy each other's company without distraction from the television, cell phones, or computers. Family meal time is more than just eating. It is all of these behaviors that connect people. Developmentally, the transitional child, meaning the older baby and almost toddler, is ready to be included at the family meal. Being at the table with others gives this young child the opportunity to observe and learn from others at the table. The transitional child learns to eat and how to behave from being included at the family mealtime. The child learns that eating occurs at certain times and places. This makes the child secure, knowing he will be fed. It also allows the child to be hungry, but not too hungry at meals and snacks. Mealtimes are a safe place to let the child be independent. At the table, the child will learn how to feed and even serve himself. Mealtimes help the child learn to eat the family foods. By observing others enjoy the family foods, the transitional child will begin to view those foods as good to eat. Mealtimes give the child a structured environment to improve his hand and mouth skills. Mealtimes are the perfect time to socialize. Establishing the mealtime habit for the transitional child will be far easier than waiting until the child is a toddler. New parents who may need practice in order to learn how to have enjoyable meals will get lots of reinforcement from their eagerly eating almost toddler. The key to starting family meals with the transitional child is to maintain the division of responsibility and to use teaching skills that support the child as he learns. Each of these points require that the parent understands how the child learns, provides foods that are developmentally suited to the child's capabilities, gives opportunities to learn, and trusts their child to learn. Look in your resource folder for this California WIC program handout on tips for happy mealtimes. Children's feeding transitions can go smoothly and quickly, or they may not. And when a child transitions slowly, the parent may want to hurry things up by pressuring the child to eat certain foods or certain amounts. Pressuring a child to eat as he is focused on learning a new skill can delay his learning and make the child feel bad about eating. Pressuring a child to eat at family mealtimes will create unpleasant mealtimes for both child and parent. Think back to Module 1 and of the skill you have taught a child. Would pressuring that child help him learn better or faster? Here is what the research says about pressuring a child to eat. Sherry found that 90% of parents of preschoolers limit menus to foods their children readily accept and then bribe and pressure them to eat. The parents say they don't believe their children's indications of fullness and encourage them to eat more. Aurel Valente showed that most parents focus on getting children to eat more during meals. 85% of parents pressure their children to eat more using strategies such as rewards, praise, or threats. Wardell's research showed that the strongest predictor of 2 to 6-year-old children's fruit and vegetable intakes was fruit and vegetable consumption and enjoyment by the parents. Here are some of the forms pressure can take. Some of these descriptions may surprise you, such as rewarding or explaining, but children know when they are being pressured even when it seems positive to parents. These pressuring techniques will make more sense to you if you think of them as ways to get a child to eat more than he wants. Pressuring a child to eat may be the result of cultural or family practices. We'll learn more about mastering family meals in Module 3. Use this worksheet to reflect on how Modules 1 and 2 will change how you educate parents. Click pause on the training while you complete this task. Then go back to the presentation and click play to start the presentation again. Additional program materials are located on the Childhood Feeding Collaborative webpage. The resource folder includes classes and other resources to which you can refer your clients. You'll also find useful websites and trainings to further your understanding of how to help parents feed well so children can learn to eat. I recommend that you find opportunities to practice what you learned. Please take Module 3 within 1 week's time of finishing Module 2. In Module 3, I will ask you to write down which aspects of educating parents about early child feeding works well and which still challenges you. You will expand your knowledge of how to apply the division of responsibility in feeding with the toddler and preschool-age child. This concludes Module 2.